This section is a little different because we don't actually do root canal procedures here at Integrative Dentistry, but we get questions about them all the time, and it's a controversial topic. So we wanted to give you a little better information on root canals and some resources for where you can learn more detail if you like. Let's use this diagram to try and clarify what we're talking about when we're using the term root canal. Now, a cavity may form on a tooth on the outside enamel layer, and that decay will penetrate into the enamel. If we catch that early enough, while it's still in this enamel layer, we can stop that decay and restore that tooth with a filling, a simple filling, and things will be just fine. If that decay, which is represented by this dark area here, if that penetrates further and gets into the next layer of the tooth, which we call dentin, then it endangers the tooth considerably more. The innermost part of the tooth, that we call the pulp, is where the live tissue of the tooth is. And if the decay penetrates deeply enough, that decay will invade the pulp and create an infection inside the tooth. This pulp chamber consists of the soft tissue and live parts of the tooth, and it's a continuous chamber down through a canal down the center of each root, and this is what we call the root canal space. And if this tissue becomes infected, it infects through this entire space. That infection of the pulp may build up pressure and pain, although it may not, but the infection has nowhere to go except to spread, the only place it can go, out through the very small opening in the tip of each root and into the surrounding bone, and that's when we're calling this an abscess. So here's a diagram of an abscessed tooth. A cavity in a tooth, even if it's a small surface one, does trigger some response by the pulp deeper down. The pulp has a healing capacity, and it triggers that healing response. If that cavity is deeper, it's more of an insult to the pulp. The pulp has to work harder to heal and protect itself. And when it's in this state where this diagram is showing, where the decay and the bacteria have actually invaded into the pulp has no chance. It becomes infected and dies, and it can't recover at this point. Here is a very important point to understand. As dentists, when we have the opportunity, we try to do all we can to prevent a tooth from becoming infected. However, there comes a point where the tooth problem can progress from being reversible or able to heal to a point where it is irreversible and the pulp's healing capacity is overwhelmed and it becomes infected and then necrotic or dead. This is a point of no return. The dentist can determine if this point has been crossed by a combination of clinical examination, X-ray examination, sometimes other clinical tests, and patient symptoms. I really want to emphasize this point, and I'm sorry that this is the case, but an infected tooth at this point cannot heal. It cannot regenerate and become a live, healthy tooth again. It cannot heal. For various reasons, the symptoms may go away, but the problem doesn't. It's still a dead, infected tooth, regardless of symptoms. It's hard to understand why this is the case. In the slides that will follow here, you'll get some understanding of that, but you'll get a more complete picture in one of the books we are going to recommend to you in this presentation. It's a long story. It is complicated, but it is a fact that a infected pulp cannot heal and become a viable tooth again. So we'll sometimes hear from a patient either making a claim like this or hearing somebody else has made a claim. Oh, I had an infected tooth and I tried whatever, XYZ, which may be antibiotics, it may be ozone therapy, it may be homeopathy, whatever, and it healed. No, that's just not the case. If it truly was an infected tooth, documented by a dentist, where there's evidence that it was an infected tooth, it is not going to heal. The symptoms may go away from various kinds of treatments, but even without the symptoms, it's still a dead and infected tooth, and it's still a significant problem. So it's at that stage where a root canal treatment is an option. Really, there are only two options: doing a root canal treatment or extracting the tooth. Leaving the tooth alone, even if it's not symptomatic, is not a good idea because it's still an infected tooth. So I'll show you some of the steps of doing a root canal treatment. Looking at this diagram from the upper left, the tooth is infected irreversibly. The dentist opens a hole through the top of the tooth to get access to this infected pulp, and with little instruments cleans out that infected pulp tissue throughout the pulp chamber and throughout the internal of all the canals of the tooth. Those canals are disinfected, and a filling material is used to obliterate those canals. The infected tissue has been removed, the canals obliterated. The tooth can then be restored with a crown to give it more strength, because a tooth that is dead is definitely more brittle and subject to fracture. So in theory, this is a tooth that can function comfortably for many, many years to come. So on an x-ray, if you look at the x-ray on the left, this is a tooth that's infected. X-ray is one of our diagnostic tools, but it's pretty clear for a dentist to see that there's been a major cavity happening here. The tooth is infected, and we can see shadowing around the tip of the root of the tooth, which you don't see on a normal healthy tooth here. When the root canal treatment is completed, it will show up on an x-ray as this bright white filling material on the picture on the right here. At the tip of the root here, if you look closely, there's still a shadow there. This would be the case if this x-ray was taken recently after the root canal treatment was done. That shadow, ideally, will fill in as the bone heals around the tip of that root. If we see a shadow like this years later, it's a sign that there has been incomplete healing of this root canal treatment. This kind of procedure is not easy. It's a very detailed, meticulous procedure. Some general dentists do root canal treatments. Most of it probably is done by root canal specialists called endodontists. For one thing, the canal spaces, as you see here, are not so straight and easy to access with little instruments. Often the canals can have a lot of variation in their anatomy and very tricky to negotiate and clean out those canals completely. This special photograph shows an actual tooth with a lot of complexity of its canals and little accessory canals, and this would be a very difficult one, if not impossible, to completely remove every bit of the disease or necrotic tissue. I'm going to try and explain a little of why a root canal treated tooth is somewhat controversial in dentistry today, and why many holistic and integrative or biological dentists have concerns that there may be some systemic health risks of having a tooth with a root canal treatment. And it has to do with the surrounding dentin, this layer that lies between the pulp and the enamel, or between the pulp and the outside of the tooth. The dentin is actually very porous. It's made of millions of little microscopic tubules that lead from the inside to the outside in the living tooth. When this pulp tissue is infected, it means this pulp is just teeming with lots of bacteria and other microscopic organisms that are pathological. The important point coming up here is that the bacteria in this pulp chamber can migrate into the dentin tubules, as you'll see in a minute here. So here's where it gets kind of tricky, and I'm only giving you just a cursory explanation. But this diagram shows those dentin tubules greatly enlarged just for demonstration purposes. Over on the right here is where the root canal would be, and the tissue that had become infected or necrotic. And part of that tissue is a layer of cells right along the inner layer of the dentin here. And these cells would have become necrotic, infected, died. The bacteria that's in this area can now migrate into these dentinal tubules. And when the root canal treatment is done and the root canal space itself is completely obliterated, these bacteria can continue to survive. This is a picture from an electron micrograph showing actual openings of dentinal tubules. These dark spaces here. Surrounding them, these are bacteria. And this just gives you a sense of scale of the size of bacteria and the size of the dentinal tubules and how easy they can migrate in there. And they in fact do migrate in there. This is a longitudinal section of these dentinal tubules, and you can see the bacteria inside of the tubules. This is known to be a fact. Nobody disputes this. The question, or one of the basic questions in this controversy, is what is the effect of any of those bacteria left over in the dentinal tubules? And the concern is that the bacteria and the bacterial toxins associated with those bacteria can migrate out of the tooth, those porous tubule opening outside of the tooth, and can get into the body through the bloodstream and the lymphatic system, and may have an effect somewhere else in the body other than just localized around the tooth itself. So are all root canal teeth a problem? How do we know if a root canal treated tooth is a problem or not? That's a difficult question. Here is a panoramic x-ray image, and we can compare a couple of teeth here. On the right of your screen here is a molar that's had a root canal treatment. And when a dentist looks at this closely, we're looking at the quality of the bone around the tip of the root, or the apex of the root. And it seems pretty normal from an x-ray point of view on this tooth. Over on the left is another tooth that's had a root canal treatment. But if you look closely, you can see there is some shadowing still at the tip of the roots. This shadowing indicates an incomplete healing of this root canal treatment, or that there is still a low-grade chronic infection going on. It doesn't make sense to assume that this infection is only localized to the few centimeters around this tooth. The body knows this infection is going on, and the infection and its byproducts can get into the system and may have effects elsewhere in the body. Now, does that mean that this tooth is perfectly okay? That's the question that we don't know. Regardless of the view on the x-ray point of view, it's difficult to know whether a tooth is actually an infected or toxic tooth or not. Here's a typical dental x-ray of a tooth that has had a root canal treatment some years ago. It's not easy to see whether there's a problem around there. This kind of an x-ray has been used in the past, but it does make the diagnosis a little tricky, and the infection on this tooth might have gone unnoticed. So a standard dental x-ray was taken of this tooth. This is you can see the root canal filling material in place. It wasn't all that remarkable. It's a little bit suspicious, but a little hard to tell on this x-ray what's going on there. This is the same tooth on a different kind of an x-ray. This is called a cone beam, or CBCT, which gives basically a three-dimensional view of the bone around the root of the tooth, and this is one slice from that view. And here it's clearly showing this shadowing a massive infection around the tip of this root. The infection is also spread into the sinus area. This is the wall of the sinus. It should be all dark and clear like this is, but here you can see all of this gray area, which is a sinus infection caused by this infected tooth. It doesn't really make sense to assume that this level of an infection would have no implications or far-reaching effects on the rest of the body. Here it's already clearly infected the sinus, but the concern is where else in the body might the bacteria and the bacterial toxins from this infection be carried away to, and perhaps have some more remote effect on some other part of the body triggered by the infection that's going on here. There's a large body of research in the last several years confirming not only an association but a cause and effect relationship between periodontal infection, gum infection we're talking about, and other systemic problems such as heart disease, stroke, diabetes, many others. It's clearly defined in the current medical literature. So an infection in the mouth, a gum infection, a periodontal infection, clearly has far-reaching effects on the rest of the body. Newer research is showing that this kind of infection around the apex of a tooth that I was showing you, those shadows around that root canal tooth, which is called chronic apical periodontitis, that this kind of an infection also is showing an association with coronary artery disease. So it's pretty clear that research is showing that an infected root canal tooth can have systemic implications. I guess the basic question is, when is a root canal tooth infected and when is it perfectly safe? And that is the million-dollar question. The American Association of Endodontists, endodontists again being root canal specialists, says on its webpage that there is no valid scientific evidence linking root canal treated teeth and disease elsewhere in the body. A root canal is a safe and effective procedure. So contrast that statement with this one from Dr. Tom Levy, who's an MD and board-certified cardiologist, who says that 80% of all heart attacks are caused by root canals. Dr. Levy goes into a lot more detail on how he's come to that conclusion from current research in this book, Hidden Epidemic. This book, which I acknowledge is fairly controversial, goes into a lot more detail of explaining just how and why root canal treated teeth are problems, much more detail than I can give you in this short presentation. So I would encourage anyone who has a root canal treated tooth or is facing the idea of having a root canal tooth done, arm themselves with this information, although you may consider this an alternative theory or alternative information. I think you owe it to yourself to have this information. So for a more standard or traditional point of view about root canals, we would recommend referring you to the American Association of Endodontists, AAE.org, and take a look at their information. We'd certainly acknowledge that there are literally millions of people out there with root canal treated teeth in their mouths, and many of them, perhaps most of them, with no noticeable ill effect. But we want to present a view that these root canal treated teeth may present a risk factor. Since the only alternative to a root canal treatment is tooth extraction, I recommend you not take this decision lightly. Do your due diligence in the resources I've shown you and discuss your individual case with one of our doctors in the office here to see what makes sense for you. That's our brief story about root canals.